It was Straightsmile Solutions, straightsmilesolutions.com, and I'm going to talk about yucky things in orthodontics and in mouths and in dentistry. So I wanted to explain the difference between herpes, this, versus a canker sore, this. Now, people get confused about the names, so I'm going to tell you the proper names. So your herpes is also known as the herpes simplex virus or oral herpes simplex virus, okay? This is a virus that is contagious. You get this from either kissing somebody, oral sex. Those are the most common reasons, although I do know a family member who kissed a baby on their face and ended up giving the baby herpes on their eye. And now this is an adult who's really struggling with vision and issues. So please don't kiss your babies. It's just terrible. Okay, so this is actually not contagious. This is just a little autoimmune thingy that you get. Could be due to friction, spicy foods. That's your canker sore, or another word for that would be an aphthous ulcer. So the way that we know the difference in dentistry is that herpes is always on the vermilion border, on the border of your lips, anywhere around. It's going to be always at the border or the corner of the mouth. The aphthous ulcer is going to be inside your mouth, not on the outside of the lips, on the mucosa of the lips and or in your mouth, not on your attached gums, but on your free gums. So it's not on the gums that are attached at your teeth level. They're further down in your mouth or on the inside of your lips, whereas this is on the outside of your lips. If you have an ulcer on your attached gums, then that's a bigger problem. It's usually an infection of some sort. So that's the difference. Yeah. So in terms of orthodontics, this could be caused by orthodontics just rubbing the wrong way. So you want to make sure that, you do what you got to do with your wax and your analgesics to get that to go away, anti-inflammatories. This, if somebody has this and they come to an ortho appointment, I reschedule them. So the reason being, and it's always a little awkward and you have to be really classy about it, but not every, people call this a cold sore. Yeah, cold sore is the colloquial term. It's also a herpes. So when we talk to our parents, we say the word cold sore, and we don't say it in the waiting room, and we don't say it around other patients because they are infectious. The reason why we can't work on a patient when we've got an active cold sore like this is that there's virus inside those pustules. And when you stretch the lips or rub it, it can rupture and it gets virus all over the face. And yeah, we're wearing gloves, but we're also stretching your face. We could touch your eye. We could transmit it to other parts of your body, on your face. Not to mention, obviously we're using universal precautions in the room and we're wiping everything down, but we don't want to actively, knowingly be spreading herpes in our operatories. So, because it could get to other people, of course, it shouldn't with universal precautions. But most concerning, we're telling the patients that we don't want to spread it to their eyes and what it gets to, and we can't predict that. So this patient will get rescheduled usually a week, or they can go see their doctor to see if they can get a prescription to bring the swelling, and bring the virus down. So once you get this, you can't get rid of it. You will have it the rest of your life. It'll come and go with stressful situations. Everyone gets these, not a big deal. So yeah, that's pretty much it. So hopefully that makes more sense for you guys in terms of what's going on in your mouth. All right, thanks.